Today's class is the Posterior Kinetic Chain, which just means the how the forces come up through the body, through the feet, in the back of the body. So all the back muscles, the leg muscles. There's a picture here of some back muscles, which I'll come back to. We're going to focus on the long muscles of the back. So we've got the ones that run along the spine from the back of the skull all the way down right into the, you can see into the pelvis here. Then you've got the neck band which come down through here. Again, they're coming from the back of the neck all the way down, back of the skull all the way down into the rim of the pelvis. And then you've got these ones on the outside which come down through the ribs, and they sort of stop at the crest of the hip. So we're going to look at these long back muscles. So we need two balls in a sock. On a day, you know, we're going to do it a little bit more focused today, but if you did it at home, you can actually have two sets of balls in a sock, and you could just come down the back. That would be quicker. But I always think if you do it that way, it's quite a lot of sensory feedback. Whereas if you do it on a single side, you can really start to target and think about the feedback that's coming and what's going on in your back. So they're both good. Before we start, I just wanted to look at a few things that you can do. If you've got sore muscles anywhere in the body, but you know, especially the back, there's just simple things you can do. $10 for a wheat bag is a really good investment. So you can put your wheat bag on anything that's sore. I've got 3. I put them on everything in the evenings when I'm sat watching TV. It just helps your muscles to relax. The other thing you can do is to take magnesium. So magnesium, at least 1 capsule a day, is going to help the muscles relax. If you take 2 at night time, you're going to relax the muscles enough that you really get a good night's sleep. So that's another good tip if you've got really sore, tight muscles. And then the other thing that sometimes people don't think about is electrolytes. So this is a brand called Musashi that you can get in Countdown, and there's also another brand called Replace. But it's got all the minerals that we need for our muscles. So it's just a really good thing to do. Even the heart. So sometimes people end up in hospital with heart issues, and it's just that their electrolytes are out of balance. So just a simple thing, as you get older, you might just think, I just need to give my body a little bit more help. So grab a ball for the feet. We'll start with the feet. So obviously the kinetic chain starts on the floor and then it works its way up through the body. So you can either use a spiky ball, hedgehog, or you can use a small ball. The spiky ball is more stimulating, and the smooth ball, which I'm going to choose today, is more for rinsing. So rinsing is where you're pushing the stale fluid in the feet up into the circulatory system. So I think it's just because I've got you guys at the top, so it's sort of interrupting the full screen. So you're just rolling out the heel. So muscles attached to bony landmarks. So obviously the heel, you've got your calves, your Achilles, all attaching to the heel. You've got your muscles in the front of the leg as well. And then you've got your plantar fascia underneath the foot. So you're just gradually working into the instep. Okay. And as you do this, if you look down at your foot, you want to see the bones of your feet sort of coming into sort of view as you're doing it. So you can actually look at your feet. You can see the tendons, you can see the bones, and you're just really working to give them all a nice stretch. So if you've got a smooth ball like me, you're going to start at the base of the big toe. You can do this with the hedgehog as well. And you're just going to roll all the way to the heel. So if you've got the smooth ball, you're pushing the fluid forward in front of the ball, and then it's sort of rejoining your circulatory system. Then the second toe. So if you're rinsing, you sort of release the ball to come forward and firm pressure as you roll up towards the heel. If you're using a hedgehog, you do it forward and back, and you just use equal pressure in both directions. So sort of very similar, but you know, just a little bit more targeted, and decide what you're doing this for. I didn't say at the beginning, but what you can also do is before you do your feet, if you do a hamstring test, you can just assess how tight you are in the hamstrings and the calves. And then if you do it again after you've done your feet, you will definitely see a marked improvement. So working from the little toe back along the tendons towards the heel, back towards the big toe. That's good. Can I just ask someone to give me a thumbs up or a thumbs down? Can you see my head or is it out of shot? Is it a yes, it's in shot? Down, it's out, okay. All right, we'll stay like this while I do the feet and then I'll adjust it. So once you've done the toes, big toe to little toe and back again, put the heel down and you're going to go across the broadest part of the foot. So we all love doing the foot massages because they can make a huge difference to the posterior kinetic chain without doing anything more. Just doing that one thing is really good. While you're here, wrap your toes around the ball until it feels a little bit uncomfortable in the top of the foot, and then lift and spread. And you want to get the toes to open every time you do that. And if you look at your toes, sometimes you might see two toes that want to move together. So you're sort of really focusing on those toes. If you get the hand on the same side and open the hand, you can get a little bit more connection with the toes. You could do the Mexican wave, little toe, next toe, next toe, next toe, big toe. Do it with the fingers, little finger, fourth, third, second, thumb. And as you do that, roll through the fingers and the toes, you just get a little bit more connection to the feet. Put the ball of the foot on the floor. So the ball of the foot is the big bone behind the big toe. And then you're going to go across the front of your heel. So this is where your fascia, your plantar fascia starts in the feet. So it's a really good one to do to keep the feet healthy. And then bringing the ball into the middle. If you've got a softish ball, you could pump the ball. And if you've got a spiky ball, you could just do a friction rub. We're just simulating the circulation. So I'm going to do a little bit of a pump because my ball has got a little bit of give to it. And then when you've done that, you're just going to switch to the other side. So we started with the heel. So just pressing into the heel. Okay, and then you're going from the ball of the foot, which is the bone at the base of the big toe, and you're going to push all the way up towards the heel. If you've got the head jog, you just come back using the same pressure. If you've got a smooth ball and you're rinsing, you just sort of lift the foot and you come to the next toe. So just working through the 5 tendons that go from the heel to each toe. Like I say, you're using enough pressure that you can actually see the reaction in the top of the foot. So people generally start off quite soft balls because they're a little bit squeamish about their feet. But as you do this regularly, you get more and more conditioned to allowing your feet to be stretched. Then you get harder and harder, firmer and firmer, and you can really start to look at the feet. You might notice a few places I've just found a tender place, which would be active trigger points in the feet. So funnily enough, I've got more on this side. Didn't have any that I noticed on the right foot. Again, that's to do with pelvic issues, spinal issues, how you're walking. And then you're going to put the heel down and you're going to go to the broadest part of your foot and you're going to go right, left. There's lots of structures in here. If you were to take the skin off and have a look, you see there's quite a lot going on in this broad part of the foot. Wrap your toes down and then lift and spread. Wrap the toes down, lift and spread. Toes down, lift and spread. You could do the Mexican wave, little finger, little toe, next finger, all the way through to the thumb, and you mirror that with your toes. So for me, left foot, not quite so much control on this side. So something to practice if you want to do brain work. Put the ball of the foot down, and now you're going across the front of the heel, right to left. Okay. Some people do these exercises sitting in the evening, which is better than not doing it, but always better to do it standing, and then you can really use a little bit more weight. And then you're coming into the middle of the foot and you're either doing the friction rub with the head jog or you're doing the pumping if you've got a soft enough ball that you can actually commit some weight into. So I can actually lift my foot off and really get into the heart of the foot, the instep. It feels really nice to do that. So it's just increasing the circulation. Okay, so if we take the ball away now, reassess the hamstrings. You might not have done it, but I can definitely feel I've got quite a lot more range of motion now through the hamstrings. So coming to sitting on the floor, I'll adjust my camera, bring my box of goodies with me. So we're going to start with calves and hamstrings. So for that, we're going to use the ball in the sock. I've got two socks, one firm ball, one soft ball. So I'm going to go with the firm, and we're going to just separate the balls a little bit. So I've got enough space there to put my thumb and first finger in between. And I'm just at the back of my heel, working on my Achilles. So you're just gonna gently work up and down. So there's a trigger point right. If I turn maybe do it this way. There's a trigger point about a third of the way up in the middle for your Achilles. So if you just have a look with a ball, you can pick one of the two balls in the sock, and you could just put the ball there and just see if you can find that trigger point. So you would point and flex, you would turn in, you would turn out the foot. Okay. So at the moment, I've got the balls stacked. I've got them one on top of the other, so they're right on the midline of the calf, and you could just go right to left. You could go up and down. So even though the balls are in a sock, they've still got the ability to roll. You could do this with a roller. And what I'm trialing today is we've got our regular roller, which is 30 centimeters in diameter. They've just brought out this new roller, which is only 10 centimeters in diameter. So it's quite good for remedial work, because often when you're doing something, you've got to be able to hold yourself up with your arms, and that's quite difficult if you're not very strong in your shoulder girdle. So with a smaller roller, you can really start to get in there. So you could change to your roller and just try the roller as well as the ball. If you've got a towel, it's not really going to work. You're going to have to use the ball in the sock. You could use the rolled up bath towel, which would be fine for the back, but it won't work for the calves because we're actually rolling. So you can see that this smaller roller means I don't have to use my arms and shoulders too much to stay in this position. Now there's another trigger point, which is up here, about a third of the way down from the back of the knee. There's one on the outside and there's one on the inside. So you've got two heads to the outer calf muscle, two heads that come into the back of the knee. So if you put your fingers behind your knee and then come down, so both hands behind the knee, come down about a third of the way, one on the outside, one on the inside. Just press with your fingers. You're going to find probably something that's a little bit tender in one or both of those. So you could use the ball in the sock, that's going to hit both of them, or you could use the roller, and you're just going to turn the foot in, turn the foot out, and you're just going to work. So for me, the inner one is quite nasty. So we've got two muscles that make up the calf. We've got the deeper one, and then we've got this one on the outside. So these are the three main triggers. You've got one a third of the way down from the heel, Achilles, and then one on the inside and one on the outside, about a third of the way down from the back of the knee. There'll be triggers all over the calves because they're very hard-working muscles, but these are the universal, well-known ones. If you've got varicose veins, you've always got to be careful about doing your calves, and if you have got bad varicose veins, then you wouldn't do trigger point work. I should have said that at the beginning. So try the other side, try the other leg. So ball in a sock, just go above the heel to begin with, and just do your Achilles. I'll get the other leg out of the way. So I'm just going up and down the Achilles tendon, point and flex. So if you get tendonitis, Achilles tendonitis, working on your calves will completely eradicate that unless you've got a tear. Will really just, so when you get the pain, it's often because the calves are just getting so tight, it's pulling on the Achilles. So working on your calves is great. So find that universal trigger a third of the way up in the middle. So that's where the tendon comes into the calf muscle, and usually trigger points are right at that point where the tendon branches out into muscle. I found mine, and you could just point and flex. You could turn the toe in, you could turn the toe out. So balls are more targeted. To see feet wiggling around on the camera. Usually I leave calves to the end and then they get rushed through, and actually the calf muscles are really, really important muscles in the posterior kinetic chain. So I'm going to go to my little roller. So you could do this with the big roller if you want to. Just make sure that you're comfortable in your shoulders. So turn the toe in, turn the toe out. There's some pretty gnarly places in here. And then if you want to do the second muscle, you're going to put your hands at the back of your knee. You're going to come down about a third of the way, one on the inside of the calf, one on the outside. Just feel with your fingers. These triggers are usually so active, they're really easy to find. So again, for me, the inner one again on this side is unhappy as well. I would say they're all unhappy, but this is relative to how painful they are. So just the nice thing about using the roller is you can decide how much weight you're going to put onto the roller. You could put your other foot on the leg if you want to sort of press a little bit harder. Not sure I want to do that. It's already painful enough. And you know, once you've figured out where the problems are, you could even do them both at the same time. Now, for me on this smaller roller, this is doable, but if I tried to do this on the bigger roller, I'd be getting quite tired in my wrists and my arms, my shoulders. So just think about that. So progressing up the chain, hamstrings. So put one hand behind the knee, where the hand is, where the little finger is at the top. I've got my thumb pointing down, little finger at the top. That's where you start, behind the little finger. You're never going to go into the back of the knee. There's too many blood vessels in there. There can be varicose veins, there can be cysts, there can be all sorts of issues. Now, immediately putting the two balls side by side, I found a really active trigger in the inner part of my hamstring. So we've got three muscles for the hamstrings. We've got a middle one on the inside of the thigh and one going up the outside, so three heads. And so it's pretty nasty around here. Usually the triggers are down at this point or up. There's some up at the sit bone for the middle one, and then the two side ones, the triggers are in this sort of bottom third of the upper leg. So anyway, just avoiding the back of the knee, don't ever go into there. So really you're sort of in the higher part of that third. I go 1, 2, 3 to the top of the leg. So you'll find them because they'll be pretty sore. For me, this one is probably about an 8, so I'm not even gonna move. I'm just gonna point and flex. So you could put the balls side by side, or you could put them one above each other and you could roll side to side across the thigh, or you could go up and down. Or if you're like me and you found the trigger point and it's pretty unhappy, just press into it 60 to 90 seconds and just give it time to release. So we're not going to need to do the middle part so much. We'll do a little bit at the sit bone. So we're really just focusing on this third. You could use your rollers. So again, a smaller roller for hamstrings is going to be a really good tool. When you use the big roller, you've really got to stay working very hard to stay up on the roller, and usually you don't get enough pressure on the roller. So you know, either use a ball, or maybe some of you might want to invest in one of these small ones. So it's still pretty much pretty bad, but I'm just going to stay here just another 20-30 seconds. So obviously, as these hamstrings shorten and tighten, that's going to feed tension up through the kinetic chain into the back muscles. Sometimes the tension is coming down from the back and the hamstrings are reacting to what's going on above. But whatever the cause is, you need to keep an eye on your hamstrings. So now the second place we'll go to is just in front of the sit bone on that same leg. And this time, rather than having them side by side, I'm going to have them stacked one on top of the other in front of the sit bone, and you should find something there that's a little bit tight. So you could just move the leg like a windscreen wiper. You could sit forward. When you do this sort of thing, make sure as you rock forward that it's your belly button. If you pull your toes up, that's already stretching your hamstrings. You're taking your belly button towards your big toe so that you're in a very neutral spine. If you drop your head, it just jumps past the hamstrings and it goes straight into your back, which is not great. So the neutral spine, belly button, navel, belly button to big toe, and that way your pelvis is in an anterior pelvic tilt. It's tipping forward, which keeps it in the legs. So as the pelvis anteriorly tilts, it stretches, the sit bone pulls back, and it stretches your hamstrings. So that's another reason that it increases the stretch. So it's the best way to do your hamstrings. You could make that a little bit easier by not pointing your toes, but still think belly button, not head forward. If you feel it in your back, then your back's not quite in that perfect neutral position. So change the other side. We'll make sure I don't talk too much and end up not getting the back muscles done. So again, one on top of the other, just in front of the sit bone. Think toes up, belly button to big toes. Now, we're using the balls, but if you had one of these small rollers, you could, I'm not trying to sell them, I just think they're really good. You could do both at the same time. And normally you'd be up here trying to stay on the roller, but with the smaller roller, you just sort of belly button to big toe. You can do them both at the same time. So they're quite good for hamstrings. And you could even roll the hamstrings because it's not so hard on the arms and the shoulders. So that's another thing that you could try. You can just point the toes down, point the toes up, and just make sure you stay in that neutral spine, and you can just be lengthening the hamstrings and shortening as you point and flex. Okay, so at this point, if you grab your roller or the rolled up towel, we're going to come into sitting on the roller, and we're going to bring our knees together, and we're going to come into a half turn sit position, and we're just going to roll out the glutes and the rotators, the deeper muscles that are underneath the glutes. So this area is always magic. There's always stuff going on here. So just find, now again with the smaller roller, it's quite firm and it's just really getting into the rotators in a nice way. You could do this on a ball, but it would be too painful. I mean, if you want to do the 2 balls in a sock, you could do the same thing, but it will be a little bit more cute. So when you're in this position, your knees together, your ankles together, your free hand is on the knees so that you're not twisting backwards to try and hold the roller. That's not great for the spine. And your chest is pointing forward to the corner. So you've got fairly good alignment through the torso. Just watch the wrist. I can feel mine. So maybe we'll turn the hand in. Just make sure the wrist is comfortable as well. If you've got painful wrist arthritis, you could do it on your knuckles. So that's a way of just taking the tension out of the wrist, which is always a bit of a problem for some people. So you're just working through the rotators, you're working up. The higher you come, so lower down is the rotators, and as you come into the middle portion, that's your piriformis, which is the top of the rotators. At this point, if you want to, you could bring your foot onto the knee, depends how painful it is. So you can either go up and down, or you can make a sort of a circle. You could come onto your elbow if you wanted to. So especially with a small roller, you could be down here and just working into that middle section. I'm going to stay up here for just a little bit longer. And once you've done the piriformis, you could uncross the legs, come into sitting, and you could just do the back of the pelvis. So we're not on quadratus lumborum in the gap between the ribs and the hips. We're at the back of the pelvis and about a third of the way down. So this is glute medius. As you go to the back, glute medius. As you come into center, glute minimus. And if you roll forward a little bit, you're into TFL. So always important muscles. So the TFL is not really part of the posterior chain, but the glute medius is. That's it. You could go into straighter legs if you wanted to and just work your way. So with a straight leg, you can just tension the muscle a little bit more. It's a little bit more torsional. You could do a little bit of up and down. You could put big pillows under the rib cage and just lie. If you're on the roller, a small roller, you could just lie there. Big roller, you'd need quite a few pillows to bring yourself into a good alignment. So that's all we're going to do on this side. We'll change sides. So you're coming into your half sit position. So ankles together, knees together. You're on the outer part of the, so if you divided your glute into a circle and divide it into half, you're on the outer half. Check what your wrist is doing. And you're just starting quite low, just above the sit bone. You can feel the sit bone here. So the 6-fingered hand of the rotators, you're on the lower ones. So sometimes one of those 6 muscles can be really unhappy, but because they're small, we don't always pick up on it. So this is a good way to just assess. And glute maximus, so glute maximus overlays these rotators. And then if you come into sort of the middle, there's your piriformis. See? Too much wiggling, I'm coming off my roller. You can bring the foot up if you want to get a little bit more in there. So the foot coming up means that you stretch the piriformis and open out the space that it's in so that you can really get into it here. So this is the area where there's a whole load of nerves come down through here, including your sciatic nerve. And so these rotators are on top of the nerves and they can press on them if they get too short and tight. Simplistic, but gives you a bit of picture of what's going on. And then from here, we uncross the legs and we put the bottom on the floor and we're at the side of the pelvis, about, in that top third of the pelvis. And we're just rolling through glute medius as you roll to the back. Glute minimus is in the middle, and if you roll forward, we're onto TFL. So just watch your spine when you're doing it. Make sure you're not doing something horrible with your spine as you roll. And you can also do a little bit of up and down. You can do straight legs, which brings in more torsion into the muscle. So you could easily spend 5 minutes here and give this a really good rolling. You could do this with the ball in the sock as well. The roller is probably a little bit of a nicer experience. Okay, so coming off the roller, I've got 2 balls, 2 socks. One is soft, one is harder. So I'm going to keep the soft one close by, but I'm going to go for the harder one. Let's move this over here. So we're going to do the, there's my picture. Not sure if you can see, but maybe if you watch the video afterwards, you can open up the video. So we're going to do the spinalis muscles and the multifidi, which are right on the spine. So they're just to the side of the center of the spine. So that would be about 1/2 inch out from the center of your spine, or it would be about one finger either side. So we use fingers because I'm talking inches and not everybody thinks in inches. So half an inch would be about a finger space out from the spine. So you want your balls quite close together. Maybe I'll do this one. You can change where your knot is in the sock, and that's going to hold the balls. So the balls are touching each other, but where the curve of the ball goes in, that's going to be where your spine is. So it's not going to be pressing directly on the spine. It wouldn't really hurt the spine anyway. With a ball, you're not going to do any damage. You wouldn't use the roller in the lumbar spine, but the balls are more targeted. So we're going to start at the bottom of our pelvis. We're going to start at the PSIS. I'll bring this over so you can see. So the PSIS is the top of the sacroiliac. So you can see where the pelvis comes around and it dips down into the sacrum. So the PSIS is here. So we're going to start here. So a little bit down from the rim of the pelvis. You'll feel that it goes downwards. So that's called the posterior superior iliac spine. And that is a really good place to put a ball because there's lots of tension there. So make sure you've got a pillow for your head. See me yet? And you're going to find that PSIS. You're going to feel the back of the pelvis, feel where it drops down into those lower bones of the spine, and just rest your pelvis onto the two balls. Now, if there's any tension in the spine, you could put your hands under your bottom, or you could put a pillow under your bottom, so there's not as much weight there. But usually it feels quite good to go here. So just start with very gentle pelvic tucks. So there's a whole lot of structures in this area. There's ligaments, there's fascia, there's all sorts of tightness in this area. So it's always a nice place to do. If you wanted to go a little bit stronger, you could just lift one knee, make sure your abs are a little bit active. You're not just asking your back to lift the weight of the leg without using those low abdominals. So as you lift the knee, it's really going to drop your pelvis into the ball and apply a little bit more pressure. So as you get used to this, maybe, depends how it feels, you could bring both knees up and you could just hug your knees and you could just do a very minute side-to-side sway. So literally millimeters movement, it's micro movements. But just relax, just actively relax, let go of tension in your body. Take a few deep breaths. So it feels delicious to be here. And you could stay here for 2, 3, 4, 5 minutes and it would feel really nice, especially if you've got SI joint issues. So take the feet down one at a time. And now you're just going to push your body downwards. Just a couple of centimeters. So each vertebra is probably about 2 to 3 centimeters, especially in the lower part of the spine. So coming up, the balls are rolling up the spine, 2 to 3 centimeters. So I'm on L5, lumbar 5, which is just above the sacral bones. And this is probably the most, how do you put it? This is the part of the spine, L4, L5, S1 is the area that we get the most problems. So L5 right in the middle could be the hot spot, So just gentle pelvic tucks. See how that feels. You could lift one knee, lift the other. So the spinalis muscles and the multifidi, the referral for the pain is local. The pain is in the spine. So the other muscles, the other long muscles of the back send pain into different places, but these trigger points, they stay very local to the vertebra that's influenced. So if you feel pain at L5, L4, whatever, then that's where you take your ball and you just find the triggers here and you just stay there. But it's always nice to start either at the bottom and work up, or the neck and the head and work down, and just work all the spinal muscles because they're all connected and through the kinetic chain, and so they're all doing something to handle what's going on. So come up another 2 centimeters, 2 to 3 centimeters. So now I'm L3, L4. So again, we're still in the area. All the lumbars tend to be the ones that get the most unhappy, but usually it's L3, L4, L5, S1. Right in the middle of the lumbar spine. So if it feels tender, if the balls feel tender, then you know that you're in the place, where the spine is really working hard, has got problems. You've found those triggers. So you stay here for 60 to 90 seconds. Don't think longer is better. Usually 90 seconds is long enough. You don't want to overstimulate the nervous system. You would just maybe try it again the next day or later on in the day, rather than stay there for 5 minutes. And then we're coming up another 2 or 3 centimeters. You can roll your body down and the balls will roll up. I'm lifting the ball with my hand because otherwise I keep moving out of shot. So this pelvic tucks, I can feel that there's quite a bit of something going on here for me. So I'm sort of L1, L2 here. If you don't like the feeling of your bottom dropping off the ball towards the floor, which is bringing your spine into hyperextension, put your hands under the bottom, or you could pull a pillow in and just use the pillow to lift a little bit of the weight away from the balls. You could just not move at all if you're in an area that doesn't feel like it wants to be stimulated too much. You could do the knee lifts if that's okay. So that, you know, that if it feels good, it's doing good. If it feels bad, then you're probably doing something that's a little bit too extreme. So keep that maxim in mind. And if you start to feel something uncomfortable, then ease up, move slightly off of that area. So for me in this position, after being here now, I can actually feel connection also down into my pelvis, into my SI joints through here. Just on one side. So when you get the picture in the brain, that's always a good thing because that's giving you a lot more information about how the pain is referring through the body. So then another 2 centimeters up. So now I'm at the bottom of my rib cage, T12. We've got 12 vertebrae in the rib cage. It's lifting my spine and my lumbar spine. And at this point, you might decide to take the pillow away from the head and put it under your bottom, just so you can control how much load is in these low ribs. So you've got 12 vertebrae in the rib cage, sort of 9, 10, 11, 12. It's getting weaker and weaker in strength, the rib cage, because they don't attach at the front. So you're always very gentle in that lower quarter of your rib cage. So don't ask those ribs to do too much. You would never put a roller into here. You'd never lie on your back with a roller in the lumbar spine. Just too much load for the back. But you can do it with the ball. You can offset with the pillow. You can put the hands under the bottom. You could just not move. I'm still doing pelvic tucks because that still feels quite nice for me. It's questionable now whether you want to lift your knees. Still okay. So then move the ball up another 2 centimeters. So now I'm sort of about T9, T10, and just do your pelvic tucks. Somebody's got bumped out. Hang on, admit. So we're still working the muscles that are close to the spine. These muscles are called the deep muscles of the back. The others are more superficial. They're nearer the surface of the body and they're further away from the spine. So another 2 centimeters. I'm sort of near the bottom of my shoulder blades now. And I might just take the pillow away from the bottom. No, I'm going to put it back. So you just want to find that perfect amount of load on the balls so that you don't feel uncomfortable in the spine. I'm still using my pelvic tucks here. So you just keep moving. So I'm going to take the pillow away now and I'm going to roll my body down. So now I'm sort of between the shoulder blades, but fairly low down in the shoulder blade. Once you get to the shoulder blade area, maybe you add an arm float. Single arm float. If you pull your belly button in towards the spine, it stops your spine lifting, keeps your rib cage under control so that you don't hyperextend and cause problems. So if you don't use your belly button, then you might lift up too much in the rib cage as the arm floats, and that could create problems if you've got, you know, if you're quite stiff, if you're quite tight. So moving down again, another 2 centimeters. So anywhere between the shoulder blades is usually really, really good, because I'm going to bring the pillow back from my head because it's hanging a bit, is because there's so much tension between the shoulder blades. So the single arm float. Again. Again. So just keep moving the balls up the spine. So now I'm at the top of the shoulder blade. I'll bring the pillow back. I go for a double arm float here. Round the top of the shoulder blades, there's always a lot of tension because there's other muscles here as well that are also very tight. And so you've got some connection to them through the fascial system. And then we're coming up again, so moving fairly quickly, but if you find something that is particularly needy, you stay there. So just feel with your left hand, the back of your neck, find that big vertebra right at the base of the neck. So you've got 7 vertebrae in the neck, and then you've got a big bump, which is the first thoracic spine. You want to just stop when you feel that big bone at the base of the neck. So I'm still quite a way down from that, but you know, you don't want to go past that thoracic one because we're going to just be a little bit more careful of the neck. So floating both arms. So I'm just under T1. T1 is sort of level with the shoulders. So the slope of the shoulders, if you feel in from there, you're going to find that bigger vertebra, which is the junction between the neck and the rib cage. So bring your knees together, just roll sideways, come off the ball a minute, come into sitting. So now we're going to go into the middle band, which is the longissimus muscles, and that would be about 3 fingers out either side from the spine. Okay, or it would be about 1.5 inches out from the spine. So I'm opening the balls. You could open the ball, you could do a knot, just to keep them separated. And then you could do another knot. So you can get fancy and creative with the sock. So, you know, they're about 3 fingers apart, 6 fingers apart, about that width. Okay, so this one starts at the base of the neck, comes all the way down, and we're going to start just at the back of the shoulders, and we went up for the spinalis, and now we're coming down for the longissimus. So you're going to be at the back of your shoulders. You're going to put the head on the pillow. You're also, as well as longissimus, which is much deeper, you're also into trapezius and the rhomboids around here as well. So there'll be lots going on in this area. So just come back to your arm floats. So we're going to just keep moving down. So you can go fairly fast, but you slow down if you find anything that's unhappy, because I want to get the 3rd layer in as well. Don't want to run out of time. So you're going to just keep rolling the body up and the balls down 2 to 3 centimeters at a time. And you're coming down through that middle band of muscles. So they're quite close together at the skull. Then they branch out through the rib cage and the torso, and then they narrow and they come down into the pelvis. So usually when you've got back pain, you'll find that one particular strata of muscles is creating the problems. I'm just going to explain where the pain referral for here. So longissimus, the pain referral is under the shoulder blades. It's at the crest of the pelvis, the back of the pelvis, the top of the pelvis. It's in your kidney area. You might get back pain in the kidney area and sometimes wonder, is that my kidneys or is that my back? And it also goes into the glutes as well. So this is now where the pain is referring out from the back. So just keep rolling down. And arm floats. So if you're between the shoulder blade area, there's a whole world of pain in here because of all the other muscles as well. So it might be the long back muscles, it might be the rhomboids, it might be the trapezius that you're feeling through here. It might be all of them. And if it is very, very painful, then you would just do this little and often. You do it for up to 90 seconds, and then maybe you'd leave it and you do it again the next day, and then the next day, and gradually, hopefully, the numbers will come down from acute to just tolerable, to where maybe even these triggers turn off altogether. So keep rolling the body down and the body up and the balls down. So I'm still just about in between my shoulder blades now, right at the bottom here. So when this muscle group is unhappy, you might notice the pain under the bottom of the shoulder blade. You might mistake it for arm and shoulder issues, and it might actually just be the long muscles. I can definitely feel for me that one side is very unhappy, the other one is fine. So you start to also figure out what's going on in the body, which side of the body is, is in trouble. So again, you're rolling down. I'm going to do it with my hands this time so I don't disappear out of the mat. So now I'm below the shoulder blades. I've still got the balls about 3 fingers out either side of the spine. Once you get below the shoulder blades, you can start to bring in the pelvic tuck. You can put the hands under the bottom. You can put the pillow under the bottom, and you can just work your way down. So coming down again, 2 to 3 centimeters. So for me, this is not usually my problem area. Mine is the one that's the furthest out, but I can feel as I'm getting away from the shoulder blades, it's not quite so bad. So that would tell me that the pain that I was feeling there was probably more related to the shoulder girdle than it is to the back. If it's the long muscles of the back, you probably can feel it all the way down. So now coming to just below the 12th rib, in the gap between the ribs and the pelvis. So again, this is another place that you'd feel referred pain in where the kidneys are, just at the back of the ribs here. And maybe it's trigger points in the long back muscles. That's not the kidneys that are playing up. It's the back muscles that are unhappy. And if you keep coming down, you're now coming into the PSIS again. So that drop in the pelvis that comes down into the sacroiliac joints, but you're slightly out now on the edges of the SI joints. It was really nice to come down through here, and you're coming down again. So now you're following the sacroiliac joint down towards the sit bones, where these muscles come down into the bottom of your pelvis. So it's easy to see with the attachments into the pelvis how sitting for too long can really irritate these muscles. So here you might want to bring in the knee lifts again. Keep an eye on the time. And then I'm coming right the way down to just above the sit bones. So the sit bones is the lowest part of the pelvis, the ischial tuberosities, which just means the pointy bit at the bottom of the pelvis, and we call them sit bones because we can feel them when we're sitting. Okay, so knees and ankles together, just roll carefully to sideways, come up into sitting. So the final outer layer is the iliocostalis. So ilio means ilium, pelvis, and costalis means ribs. So it's coming right down. So you're really sort of a good hand space out from the spine, sort of outside of your little fingers. So you might want to change the knot in the ball, in the sock, so that you can just get that little bit wider. So you want a good hand space either side. So if the knot in the middle is the spine, then your hand space either side of that. So you can see how the sock helps you to sort of control a little bit what you're doing. So this one starts at the shoulder blades and it comes right the way down to the crest of the pelvis. So not quite such a long line. And the pain referral here is under the shoulder blades again, anywhere in the back of the rib cage, the kidney area again, and definitely into the glutes as well. And this one, if you've got sacroiliac joint problems, is quite often the one that's going to be upset. Tension coming up through the legs, through the SI joints. So we're going to start at the base of our shoulder blades. Okay, bottom on the floor, and just do some gentle pelvic tucks. So for me, when this line is up unhappy, I always notice it, first of all, that I've got a pain right under my shoulder blade, at a place that I can't quite reach, and that's where it originates. And it's always, for me, it's always on one side. So when I feel that pain in the shoulder blade, I know that I need to come down and relax this line. So I'm just doing gentle pelvic tucks, and then you're going to bring the ball down 2 or 3 centimeters. Maybe come down a rib at a time, and just do your pelvic tucks. Maybe there's a knee lift, but remember ribs, as you go lower in the rib cage to that bottom quarter of your rib cage, you don't want to put direct pressure on a rib because they're just not strong enough to take that shear force pressure. So I think I'm going to get rid of the knee lifts, and I'm just going to stay with the pelvic tucks, coming down again as we get lower in the rib cage. So this is also going to bring you down either side of the erector spinae into your quadratus lumborum. So you've got your legs taking tension up from the feet, from the floor. The forces go up through the SI joints, they come up through the quadratus, and then they come into these long bust muscles of the back. All the way up through the rib cage, up into the neck, and finally, ending up in the neck as well. So come down again. So now I'm just under the 12th rib, which is the trigger point area for quadratus lumborum, the muscles that attach to the lumbar spine. Right on the outer lateral border of the erector spinae, which are the big muscles of the lumbar spine as well. The QL is just underneath the erector spinae, so you've really got to stay here a little bit longer to get into QL. Come down again to where you're at the back of the pelvis, on the rim of the pelvis. So this is the hot spot really, where the iliocostalis attaches to the pelvis. And maybe here you come back into a knee lift. If you can feel it's one side, you could just hug the knee and just get in there. Maybe you feel comfortable with both knees. You could do a little bit of side to side sway. Make sure it feels comfortable. Make sure your neck is supported. If you've got a dominant neck, you don't want your neck hanging towards the floor. Otherwise, it's going to be very hard for these muscles to let go. You could bring your head up. So bringing the head up, you can sort of feel the connection from the pelvis through the long back muscles into the neck. Gently bring the head down, take the feet down one at a time. So take the ball away, so that's all you need to do is stop at the pelvis for that line. So now just knees together, roll sideways, come up into sitting, and we're going to keep your pillow there. You can either use your roller or you could use the roll up bath towel. I'm going to use the new roller. You can use this one with me. And you're going to just bring the back of your shoulders. So remember, you've got the big vertebra at the base of the neck. You're below that, level with the shoulders, just in the deep muscle at the back. And we're going to just bring our hands together, hands behind the head. We're at the back of the shoulders, in the trapezius. But we're also going to rinse all the way down the back. So we're going to we're just going to rock up and down through about 2 or 3 centimeters. So the head is supported. And I'm just moving up and down through 2 to 3 centimeters. And then I'm going to roll the body up another 2 to 3 centimeters, and I'm going to rock here. So we're really working all the muscles of the back as we do this. Abs are a little bit active, so you don't have to work too hard. And the legs are doing the push-pull, and my abs are not relaxed because I'm in a strange position, so my spine needs to be supported. So again, 2 or 3 centimeters more, I'm disappearing out of shot, so we'll come down a bit so I'm staying in the frame. So remember, you've got from that big bump at the base of the neck down to the bottom of the rib cage, you've got 12 vertebrae and 12 ribs in the rib cage. So we're only going to work between T1, the big bump, down to about T9. So we're not doing the lower quarter of the rib cage. And you know when you get there, because it just feels, as you come in towards that area, you just don't feel comfortable, you don't feel strong there. And that's the time to stop. So I'm just wiggling my way down the spine. So I'm about T8, T9, and I'm just noticing now, yeah, I can just feel, my brain can tell I'm not in the strong part of my rib cage. I don't want to go any lower. So now I know where that bottom point is. I'm going to roll all the way up to T1, and then I'm going to roll down to T9, and I'm just going to keep rolling through that upper 3/4 of my rib cage. Keep your chin tucked. Make sure your neck is not active. Your head and neck are supported by the hands. What's working is the legs and the abs. And you're just going to rinse the large muscles and the deep muscles of the back. So just pushing all the fluid through the muscles. You get an exchange of blood and lymph as you do this. It just feels great for the back. So now just bring the roller to the middle of your shoulder blades. Keep an eye on the time. Put the bottom on the floor. Abs are engaged. Keep your chin tucked. Just breathe in and look at the ceiling. And breathe out, contract your abs and look through the knees. Breathe in, look at the ceiling. So this is thoracic extension. Breathing out, contract your abs. Look through the knees, make sure this is comfortable. If it's not, you're going to modify the movement. Breathe in, breathing out. One more, breathe in, breathing out, and then take your hands forward, lift your knees, swing up into sitting, and we'll just finish with the neck. So we'll put the roller at the back, lie down, put the roller at the base, at the back of your neck. Find the rim of the skull and just gently roll your nose from right to left. So all of those long muscles came into the neck except for iliocostalis. And we're just really working where those long muscles attach to the back of the skull, the rim of the skull. You can feel there's a lot of tension here. So some of that is neck muscles, but some of it is the long back muscles as well, where they come up into the rim. You could stay on one side and do some nodding, nose up and down, side to side, circle the nose. Do that again, up and down, side to side, circle. You could easily stay here for 5 minutes if you had time. Come back through center, go to the other side, up and down with the nose, side to side, circle. Up and down, side to side, circle, and then just go broad strokes right to left. Excuse me, coughing. So you can feel the tension here just gently starting to melt away. And then coming into center, just bring your knees together, roll sideways, carefully come up into sitting. And that was the posterior kinetic chain.